We have general nursing, but we also have different specialties. I mean, we have anesthetic nursing, postoperative nurse, we have psychiatric nursing, we have pediatric nurse, we have a lot of specialties in nursing. We have public health nurse, we have the midwives. So we have a lot of specialties in nursing, right? So all of those people are specialized in a particular field, right? A public health nurse is someone that works in the community setting, in the public health setting. We have nurses that work in the an aesthetic nurse, post-operative nurse. We have occupational health nurses. Occupational health nurses work with companies or in companies, because they are occupational hazards. I mean, every job has its own risk, right? Health risk. And occupational health nurses are there to perform the function of a nurse in that setting, right? Provide first aid, ensure that people working do not get occupational hazards and all of that. I have nurses that work in the ICU, that's in the intensive care unit. We have perioperative nurse. That's a nurse that works in the operating room. They ensure the environment is sterile. They assist the surgeon. That's what they do. We have pediatric nurse. They are experts in the growth, development, and diseases. Experts in the growth, development, and diseases of children from childbirth through adolescence. We have the mental health nurse. They focus on the psychological well-being of patients and the managed conditions like depression, schizophrenia, or addiction. We also have nurses that educate nurses. Like, I mean, as a nurse, you can work as a lecturer. I mean, there's no way you can't work. You can work everywhere. They even need you in the military. They need you everywhere. They need health workers everywhere. We have travel nurses too. We have nurses that are in administration. So, for example, now we have nurses that work in Ministry of Health in Nigeria. There are nurses that are in charge of helping people renew their licenses at the appropriate time. Those nurses, you can say they work in administration and you can work in Ministry of Health. We have different things that go on behind the scene. I told you there were advanced roles. We have advanced nurse practitioner. That's when you have your master's degree and your PhD. Most advanced nurse practitioners are specialized practitioners in many countries, and I mean, this is still something that we're still trying to attain in Nigeria. It's still growing, it's developing, trying to metamorphosize or whatever. So we're still trying to attain that in Nigeria. An advanced nurse practitioner can diagnose diseases, can order tests, can prescribe medications. They function in the highest level possible. They can refer, they can have their own practice. They are independent clinicians. Those are who advanced nurse practitioners are. We have nurse consultants too. Those are experts among experts. I know there was a time a consultant battle was happening. So let me explain what a nurse consultant is. They do a lot of things, but in summary, they are like experts of experts. So you can really imagine a nurse that is an expert of experts in a particular field. So basically, they are called in for advice on most difficult cases. Like, they give advice on most difficult cases. They work with a team. I mean, a consultant, they work with a team to provide care, specialized care to a patient, and they also give advice on health policies or hospital policies. I mean, in difficult cases, they give advice to change hospital policies too. So, for example, a nurse that is specialized in oncology, she's a nurse consultant of or in oncology, and she's just so good, an expert of an expert, has so much experience, can be a nurse consultant. Most of those roles are still trying to, metamorphosize in Nigeria. So, like, we have nurse manager or administration. So they run the business side of nursing, right? So because there's a way we do our things in nursing. So these are the nurses that do things like staffing, budgets, hospital laws. They handle staffing, budgets, hospital laws. They ensure the ward has enough oxygen, medicine, and nurses to stay. Right? You can imagine. Okay, I don't know if in your hospital you have Oga, like the nursing manager that comes around and asks you how many of you are on duty, are you enough, how many critical patients are there, do you have oxygen, is there light, and you have someone you call when there's no light in the hospital. That type of person is your a nursing manager or a nursing supervisor. You have those people that handle budgets, that handle staffing, that handle laws in the hospital, and how nurses should behave themselves in the hospital and all of that. So those people are nursing administrators, and they're also nursing managers. So then we have the digital part of nursing. Nursing informatics is like the marriage of nursing and computer science. Like they design electronic health records and apps that are used in hospitals. That's a part of it, because nursing informatics is actually very broad, very very broad. So for some people working in informatics, they work with, you know, their companies, research companies or healthcare companies that want to make an app. Their technology companies, but they want to make something relevant to health, and they take a lot of data, like electronic data of patients, and they need a nurse to interpret it, or they need a nurse to give recommendations to them. Some nurses work in informatics doing something like that. And so we also have some nurses that actually design electronic medical records, electronic health records. I mean, we also have nurses that design health apps or work with tech companies that design health apps and that are used in hospitals, or all these apps that are used to analyze human health, that are used to analyze data, that analyze data to see how we can use that to make treatment faster and, input technology into nursing. We have telenursing. Telenursing use telecommunications to provide care. That is, a nurse in Lagos can monitor the vitals of a patient in a village via screen, via online communication, giving instructions and guidance on how to manage the condition of the patient. Some nurses work online to create tailored meal plans for patients with critical conditions like diabetes, hypertension, following them up and making sure they are living the best possible life with their condition, or those that have a terminal illness. Nursing is also very broad. We have plenty other aspects of nursing, and it keeps evolving every single day. So basically, you should know what nurses do is very broad. I can't exhaust it, but nurses are very versatile. Nursing is very amazing, and you will love nursing. I would advise specialization for anybody, because I think it's better to just niche on a certain thing and know that that's what you do, right? So, I mean, I want to specialize. So, if you can, please specialize.